if someone has a spinal cord injury anywhere in the province, regardless of where they're injured or when or how they're injured, the place that they come for their care of their spinal cord injury is the Spinal Cord Injury Unit. Within the Vancouver Spine Program, we have 6 full-time spine surgeons, and it's a dedicated level of expertise where these surgeons have just one area of focus, and that area of focus is spine care, providing the best care in the world. One of the patients that I've had the privilege to take care of is David McLean.
Pain is something that you just don't want to live with day after day. And I'm very sympathetic to people who have back pain in particular, and I had back pain for over a year. I met Marcel Dvorak, who was the head of the spinal clinic. I consulted him because the last thing I wanted to do was have spinal surgery.
He made us feel like we were very, very special. He took all the time we needed, and he explained the procedure and made us feel extremely confident.
So it was relatively shortly thereafter that he operated. And I was lucky, I was able to catch this before it did permanent damage. I think a lot of that had to do with good medical care at all levels.
We can really take discoveries that come out of the laboratory and out from under a microscope and apply them to patients, probably better than any other center in North America. One of our surgeons has a PhD in spinal cord regeneration biology, and Dr. Kwan spends half his time in the lab working on spinal cord regeneration and the other half taking care of patients with spine and spinal cord problems.
We now believe that it is possible for, with a better understanding of that, the neurobiology of the spinal cord injury, that we may eventually develop treatments for it. For me, when I walk into this hospital, I walk up onto that ward, and you see those young patients or those young individuals with this catastrophic injury, you can't help but have that fuel, the passion to try to find something that would improve their quality of life.
Costs of care are exponentially increasing, and there are new technologies. For example, new X-ray technologies, new technologies in the operating room that are always coming up and always potentially things that we could apply to our patients to make their lives better. And this is one area where the foundation really steps up and helps us to keep pace with the growth of technology.
I think that's what the foundation's role is really to provide the extra things that the system can't provide. Every day, to me, is an adventure and is an exciting opportunity, and the fact that I can live that day without pain, without a lot of suffering, I feel very blessed.